Good morning and namaste and salam alaikum everyone. I hope all of you can hear me. Welcome to this next in webinar, a series of webinars that IBPC is conducting. And today's webinar is from the focus group Education and Health. And this is a very relevant topic on stress management and mental health. We are really lucky, and it is my pleasure that we have today Dr. Anjali Chabaria, who is a noted psychiatric doctor and psychotherapist with over 30 years of experience. She has agreed to join this, and that is really a pleasure and honor, Dr. Anjali. And I will talk a little bit about her. She's an MBBS from JJ School of Medicine, Mumbai, and MD from Nair College and Hospital in psychiatry. She also has a diploma in psychotherapist. She runs a consulting firm called Mind Temple, and also a trust to help citizens in Mumbai, which is helping the hospitals, called Golden Citizens Trust. So besides this, she has been on TED Talks talking about teenage mental health. She has appeared on a documentary of BBC, which is regarding anorexia. In India, almost her views and articles have appeared in Times of India, India Today, Sevi, Women's Era, to name a few magazines. And besides this, she has also appeared on a number of television channels in India and keeps on appearing from time to time on children mental health, on teenage mental health and stress management, and on adult mental health. She is also a regular contributor to Free Press Journal from Delhi and another magazine called Sindhian. Again, I think that is published also from Delhi. So she has a great experience in this. She's also the ex-president of Mumbai Psychiatric Association. She's very noted not only in India, but internationally. Right now, she will be speaking to us from Mumbai. Also, as we go through this webinar, I would also like to introduce Dr. Brajesh Mittal, a noted cardiologist who is based in Dubai and is a committee member of the focus group on education and health. And that's Dr. Brajesh Mittal. He will be moderating this session and he will take it on from the Q&A session. We really hope that you enjoy this, especially given the time of economic, financial, and health concerns and anxieties people have. So we can learn something and enrich our lives and make the management of this lockdown much better experience for all of us. And wish you all good health and happiness during this time and a good management. With that, and without further ado, I would like to hand it over to Dr. Anjali Chabaria. And thank you, ma'am, doctor, for joining and accepting our invite for today's session. Thank you.
Thank you, Dilip, for inviting me. Thank you, IBPC, for calling me here. And thank you to all my viewers today. So isn't it surprising that all of us, all across the world, today are actually locked down in our own houses? Well, is there something bad about it? Is there something good about it? So to all of us who were actually waiting for this period, okay, and we're all learning technology in the last few days, the amount of technology that I have learned in the last 1 week has been much more than what I have learned in all my life. So again, getting back to the topic. So, I think today the world is really a flat place because all over the world, all of us have actually been locked down into our own houses. And a house is something that you strive so much time of your life to make. Today, actually, we've got a chance to enjoy our house, to enjoy our family, to enjoy our kids, to enjoy our parents, to enjoy our grandkids. And that is, if we take it in that way, if we accept the fact that, yes, we are locked down in our own houses, the faster we accept it, I think the better the journey is going to be. Of course, people are stressed today. I don't know one person who is not stressed. Yes, there are those who've been able to successfully manage their stress, and then there are those who are struggling. People are worried about finances. The employers are worried about how they're going to pay salaries. The employees are worried about whether they'll have a job or no. Children are worried about their studies. Grandparents are worried about their kids' health. Kids are worried about their grandparents' health. So, yes, on one simple strain, we're all worried. And because of this worry, a lot of people are losing their sleep, a lot of people are losing their health, a lot of people are getting anxious and are waking up in the morning with panic attacks. Then there are those who are either undereating or overeating. And of course, some people are even getting so worried that they are getting depressed. They are feeling extremely anxious toward in the whole day, and their body health is suffering. So, this is the time we actually need to look at it and see how are things going to span out. Well, the only one thing which is certain today is the uncertainty. And that is again across all age groups, all people. And just now before I got onto this call, my maid called up and said that, okay, what about my salary? And I told her, yes, we are trying to transfer your salary, but let me know your bank account. And she was finding it so difficult to just give these simple details. And a lot of things that we actually used to do so normally earlier, everything that we had taken for granted, just to go out and get some bread and some vegetables, was so easy in a place like Mumbai. But today, that itself, there's so much of, there's a truck that comes with vegetables one day, there's a truck that comes with fruits one day. And that is how a new lifestyle is going to emerge. So what do we do? How do we make sure that while we are going through this, how do we ensure that we at least take care of ourselves, and can remain stress free? A few things that have been working with some people is, if we can keep a routine in the day. A lot of people, when they started working out of home, were finding it very, very difficult to maintain a routine. They were either waking up in the middle of the night, they were finding it difficult to go to sleep at night. They did not know when to work, how to switch off their work, how to even manage their time accordingly. And then, yes, first few days, we were all in a state of disbelief, in a state of shock. How can Mumbai stop? How can New York stop? How can Dubai stop? And then soon we started getting used to this new lifestyle. Yes, a few tips to see how people have been successful. Make sure when you get out of bed, when you wake up in the morning, just get out of bed in the first half an hour of your sleep. Don't start worrying in bed, because there's no end to that. Will I fall sick? Every day we're all getting updates on the COVID score. It's almost become like a cricket match, which is unending, where we are all getting updates from the area. Fortunately or unfortunately, I'm staying in an area in Mumbai which is most affected. So yesterday we all got an update that day before there were 10 cases, yesterday there were 134 cases. So now, is this update really helping us? So as soon as we wake up, I think the first thing is, get out of your bed, get out of your night clothes, and go sit in a place where you can enjoy some bit of nature at least. I know a lot of us are not fortunate to have gardens or to have terraces with, which overlook the beach. But at the same time, we could be sitting next to plants, we could be sitting next to an open window. Have your cup of coffee there and remind yourself that you are not alone in this, that the entire world is with you. Many a times we feel that our stress is really too much. But when we wake up in the morning, the first thing is, start your day with some gratitude towards nature, gratitude towards whatever religion, whatever spiritualism that you believe in, and say thank you. Thank you, I'm healthy. Thank you, I'm waking up from my bed. Thank you that I am not sick and none of my family members are sick. Once you start your day, once you've finished your breakfast, etc., sit down in a designated place to work. Make that your workplace, and your workplace should not be your bed. After you finish your work for the day, make some time to what is it that you would like to do. Today, a lot of us also, I don't think any of us have ever seen a pandemic in our life before. Yes, some of us have seen the 1971 war as kids in India. And I keep remembering that time because that was a time that as kids, the first time we learned that yes, there could be some stress. There used to be blackouts. A lot of you may remember that there used to be blackouts at that time. As kids, we were told to finish off everything, and then suddenly we would all huddle in a corner, and sit down over there. The first few days were really scary. But then after that, what we started doing was we started playing games around that time. We would either play Antakshri, we would play some word games. And then soon it became a natural ritual for us. Yes, what else did we have to do? We were all given our responsibilities. We were little kids, so we were told, some of us were told to wash spoons, wash plates, and we would all have so much fun. I still remember that we would all eat out of one plate, not because there weren't plates in our house, but because there were those two less plates to wash. And every chapati that came to us was divided into 4 parts, and we all shared it. And that was the time that it made it so much fun. There was so much stress, but we did not get stressed. And that is what I want all of you to start practicing today. A lot of us have gone through the 2008 financial crisis and so many other ups and downs that we have seen. Every time there was a down, we thought this period is never going to get over. And good times will never come back. And yet, after we spent that time, yes, we all came back. What is the best that we need to do now? We need to go through this period and also be prepared for bad times to last. And when I say bad times to last, yes, some of us could get sick. Some of us, we could lose a loved one. Some of us could financially not recover. Some of us may have to restructure the way our economics are, our finances are. And this is the time we need to start preparing for that. How do we prepare? Let's see if we can restructure. When I talk about restructuring finances, the first thing that everybody is saying is separate your needs from your desires. What is it that I really need now? Yesterday, I was talking to someone who was saying that I don't even know, I've paid the salaries for March, but I don't know whether I'll be able to pay the salaries for April. And one suggestion that came out of our discussion was, I said, why don't you discuss this with your employees? Tell them that you're facing a financial crunch. She said that I've never done this. I've always paid my employees their salary. How will I tell them that I cannot pay your salary this time? Well, this is a first time for all of us. And we need to see in the discussion, this was a person who runs 5-6 restaurants. So I told her, is there something that you could liquidate? And she said, yes, you've given me a great idea. I had a lot of rations stocked up. Let me talk to my grocer and find out whether he's willing to buy that. I can always buy some more ration later on. So we need to look at new things as to how we need to solve this crisis. And that will only come when your mind is relaxed, when you're able to think. Now, to relax your mind, yes, you need to understand what your anxiety is. What are you worrying about? Are you worrying, whatever you're worrying about, is there a solution to that? Can that be solved? Or is it a worry that actually has no solution? So for example, if I'm taking care of sitting at home, I'm making sure I'm not getting out of the house, I'm not unnecessarily walking in and out of the house. So the chances of me to infect myself are less. Now, after doing that, can I yet be affected by the COVID virus? Of course I can. But looking at the statistics, the chances are less. And even if I'm affected by it, do I fall into that age group? Now, once I can't do anything about it, then my unnecessary worrying is not really going to help. So I need to stop worrying unnecessarily about things which are not in my control. Now, once we've done that, let's also, this is the time that you have. I used to always think I have accumulated all these books, maybe 300 books, which I think that I'm going to read. When will I get the time for that? This is the time to do that. We've all thought of that time that, when I have time, I will up my skills. I will learn few courses. This is the time to do that. We all have so many webinars to choose from. Well, if you ever wanted to have music lessons to pursue your hobbies, this is the time to do that. This is also the time to reconnect with your family members and ensure that nobody else is getting stressed. In every family, what happens is that people's motivation levels are not the same throughout the day. One day, one person is motivated, one person is feeling low. So reach out to that one person who is feeling low and don't give them gyan, don't give them bhashan, don't tell them you're not supposed to feel like that. Of course, we can feel low, we can feel upset. Someone may not be able to get up in the morning. Don't go and tell them, come on, get up. In fact, just go sit next to them and wait for them to share. This is the time that we need to develop our listening skills, not our talking skills. Listen to what their concerns are. Maybe your young child has started a new venture, and because of this lockdown, he or she feels that the venture is not going to succeed. Tell them that, of course, let's see what else you can do. What is the best that we can do and in this time? This is the time a lot of my friends who are doctors are also worried. I was talking to some doctors in Dubai just to understand what they are going through. And they were saying that the hospitals have told them that, okay, don't come to the hospital now. So they are worrying because some of them have got kids who have to pursue their education. And they had all thought that their salary, their savings would be able to do that. And right now, they don't know how they're going to manage it. This is the time to sit down with your children and also tell them nice stories. Those of us who have been in the freedom struggle and gone through the stress, discuss that with your kids. Tell them about the positive stories as to how you came over here with nothing and made it big, so that they understand that yes, you have also gone through something like this before. Also tell them that this is an opportunity to develop some new skills and to try it out. People are also talking, everybody's talking about the bad economy time, but a lot of people are also talking about the new opportunities that are going to come up. I was so happy sitting in my own clinic and seeing maybe around 30 people a day. And I think I'm connecting with more than 2,000 to 3,000 people a day just sitting at home. So I don't like this word social distancing, because actually today we are only physically distancing. We are socially more and more connected with so many people in the world. The other thing what I would like to say is that we also need to connect with our family and friends and to find out how they are doing. So pick up the phone, make video calls to your family, to your loved ones, to people who are not staying close to you. A special attention to people who are living alone. Your friends who are living alone may be feeling extremely lonely because they feel that, if something happens to them, nobody will even come to know about it. So if you can connect with those people, when you're getting out of your building, if you're going out to buy grocery, I know a lot of people are already doing that, connecting with the neighbors and finding out if someone needs something. This is also the time to rediscover some passion, some hobby. So start singing, start dancing. Exercise is something that is really helping a lot of people. So when the lockdown started, one of the rules I made in the house was that every evening between 6 and 8, everybody is going to exercise. So it was really a funny sight to see someone dancing, someone doing yoga, someone running around up and down. But that became a routine. Now everybody's found their own time to exercise, but that is really keeping spirits up, because exercise increases the positive hormones, and it also makes you conscious of the fact that you're not going to overeat or undereat. Social media addiction is a huge problem in houses today. People, especially teenagers, want to just sit locked on their laptops or even on their screens and watch, and unendlessly they want to watch TV shows or to play games. Initially, do not stop them, because they are also not used to this new way of being locked down. They want to meet their friends, they want to go out, they want to socialize, they want their own space. They are also not used to seeing their parents around for so long, and because of that, they are feeling a little interrupted in their routines. I've been talking to teenagers who tell me that, they were looking forward to their college admissions, and suddenly they don't know when the college is going to reopen. Some of them are worried because they feel that their parents are behaving like teenagers and are going out of the house and not taking the lockdown seriously. And that is what is also bothering them. So please try and give your teenagers space. Talk to your teenagers as if you would talk to someone else's children. Imagine if my child was living in your house, you wouldn't tell him, Akshay, come and have your breakfast. You would tell him, Akshay, there's breakfast on the table, please eat it. So the way we talk to our teenagers is also how they will respond to us. So if you feel that your teenager is just locked into the room and their timings have reversed, a lot of teenagers are also telling me is that, we sleep the whole day and we work at night, because that is something that allows us to keep distance from our parents. Some of them have had to discontinue their studies abruptly and call back. They are also getting stressed. Relationships are getting stressed. I was talking to someone today, it's their anniversary, and we were just laughing about it. I said, I don't think you've ever spent so much of uninterrupted time with your spouse. Surprisingly, we've all heard of relationships getting disrupted in China and people going towards divorce. What we have seen, that people who used to come to us for counseling earlier, they have actually started getting along better with each other, probably because they have the time to sort out their issues, or maybe because they feel कि अभी चलो इसी के साथ रहना है, so why complain, you know? But of course, there are people where domestic abuse has gone up. There are people who are getting extremely distressed, moving towards alcohol, drinking every day, and that itself is creating a new problem. So we have all sorts of new things happening over here. Yesterday, someone asked me something very interesting, and they said, do you feel that the human being will evolve because of this lockdown? Will we change as humans? I really think we will change. Maybe we'll start valuing what we have. Maybe we will start realizing that we don't need 20 pairs of clothes. We can very well do with 3 or 4. Maybe we will start giving much more. When Dilip introduced me and he spoke about the trust, our trust was not doing too much work. It was a very thanda trust. People used to do work for senior citizens and just kind of pleasure activities for them. When this hit us, and when I was talking to doctors all over the world, and they said, guys, you're a poor country, you are going to run out of government resources very fast. So we started using our trust to build resources for healthcare services, for the cops, for the doctors, etc. And I was surprised to see the amount of good that came out. So many unrelated people working for the same cause. And that is something that took my depression away. For the first 3-4 days, I was feeling really helpless. I was feeling so bad that there are all those doctors who are fighting in the midst of things. A lot of doctors, let me share with you, have lost their lives all over the world. Hundreds of healthcare workers have lost their lives just because they did not have adequate protection. And we did not want this same situation to happen in a poor country like ours. So the day I came out with this solution that yes, I'm going to do something to do my best to help my brothers and sisters who are fighting there, that's the day I started feeling much better. And that brings me to one point, that is when you give your time, when you give your money, when you give your resources, this is also the time to declutter. We all have so much of extra things in the house. So one of the first things we did was we removed all the extra bed sheets, and my daughter has a sewing machine. She got that out, and we started making masks out of all the extra washed and clean bed sheets that we had, and we started distributing in the slums. And we did this much before the time it was announced that we need to wear masks compulsorily. Okay, now she's a designer, so actually we started laughing that you're making designer masks for people. But that is something that made all of us feel so good, that yes, we were using our time effectively, we were connecting with people, we were upping our skills, and yes, we were doing something to make other people's lives better. So with this, I think let's go on to the questions. And I can see one question which has already come onto the screen. And that is that I'm a perfectionist. I have always known a job to be 9 to 9. How do I make the most of it? How do I recharge, or how do I rewire myself to be sitting in this period of lockdown? Yes, so perfectionists are people who always like to know where they are going. And they are finding it a very, very tough, because the only thing certain about this period is the uncertainty for how long the lockdown will last. How many days are we going to be locked down? Will I be able to go out? Will my workers come back? Will my job be there? So yes, you perfectionists, this is the time to rewire yourself. This is the time to reinvent yourself. So start your day by telling yourself that I'm not alone, and let me see how I can change. If you need to meditate, if you need to do yoga, if you need to run, jog, if you're the restless variety, run in one place, cycle, do what you have to do. But get your mind, calm your mind down, because it's only when your mind is calm will the solutions come. And yes, talk to your friends. The biggest problem is that when a problem hits us, we feel that we cannot share. This whole sharam, shame. How can I tell someone that I don't have money, or I don't have resources, or I don't have a job? Let me remind all of you that I'm sure all of you must have heard of Mr. Amitabh Bachchan. When he was going through a financial crisis, what did he do? He did not say that, no, 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 I'm Mr. Bachchan, how can I ask for work? He actually went around and started telling everybody around that, listen, I have failed. I need work just now. Can you help me? The humility of the man and the loss of ego helped him to come back again, to almost become, he is someone who is probably the one of the most successful people in India and maybe in the world too. If he could put his ego aside and tell people that I want work, I think we all can do that. So please keep your shame aside. Talk to your friends. Share with them what you're really going through. And when you do that, they will also open up and they will also share with you. And many of the times when we share with each other, that is the time that the solutions come. Sometimes the solution can come from yourself. Sometimes the solution can come from your friend. Maybe just listening to your friend saying that, I'm also in the same boat may make you feel better. And if you don't want to do that, you can just pick up the lots and lots of helplines all across the world. Pick up the phone and talk to a helpline. Sometimes people feel, but how can a psychologist help me? How can a psychiatrist help me? Try it out. Maybe you will get the answers. And yes, before I ask Dr. Mithal to join, there's also one special percentage of the population which is already going through anxiety and depression. We need to take care of that population. Please make sure that their medicines are on. If some of you are still not able to sleep, are feeling depressed, please contact mental health specialists. If they're telling you to take medicines, don't feel that, oh, how can I take a medicine? You know, I will not take medicines for depression because I will get hooked onto it. All that is, it's all old stigma. Today's newer medicines, today if you need to take a medicine, please take a medicine, because there are newer medicines which are not sleep inducing. They will actually help you to cope and cope better. You will be fine emotionally to take the right kind of decisions. And yes, there is another special population, which is, what if I'm corona positive today? There's a lot of stigma which has started all over the world, which is that today, if somebody is COVID positive, the person gets stigmatized. People start looking at them as if they've got, they're HIV positive and they've gone out and done something wrong to become positive. The person could have just traveled and come back. And in India, what we saw was happening is that their names and their building names were being circulated all around, and people were talking to them in such a bad manner. I request all of you who are watching this show that anyone can be COVID positive. So if someone is going through it, and the worst thing that happens is the isolation. Now, when these people are isolated, maybe you can just reach out to them, and instead of trying to gossip about them, just reach out to them and saying, listen, I know you're alone. Do you need any help? Does your family need any help? Because today what is happening to them can happen to you too. So let's be positive, and let's wait for the questions.
Hello, good afternoon, Dr. Anjali. Thank you so much for an excellent presentation on the contemporary situations. And it's in a very simple, easy way you gave your talk so everybody could understand. Before I embark on the questions, I will take this opportunity to just summarize what you have said now in very few simple sentences. So for those, some people have joined late, so I can start with that what all Dr. Anjali said in a very simple keywords. Just have a routine, have your gratitude for waking up in the morning and what you have, keep yourself engaged continuously so that you don't get depressed. Differentiate between your needs and desires, because this is the need of the hour. And for everybody, it is first time. So don't feel that whatever action you are taking now and you have no experience, but nobody has got experience in dealing with a pandemic. So it is first time for everybody. And you have to relax on your mind, which I like so much, and then reconnect with your family, reconnect with your friends. As Dr. Anjali said, that we should not call it social distancing. We should rather call it social reconnecting and physical distancing. So very rightly said, Dr. Anjali. And then we have to look for new opportunities which the new situation is giving us. Besides the negative, there are lots of positives. We have to rediscover our passion in the things which we were wanting to do for a long time and were not able to do due to constraints of the work and pressures. Then, as also a point being taken out very rightly, that in general, the relationships have become better by staying together. So it is a positive sign. Then we should value what we have. And last but not the least, he said that put your shame aside and deal with the situation up front so that you can overcome it. So this is a very simple gist I dare to take out from your presentation, Dr. Anjali. I hope I covered most of the points what you said. And so now we have some questions. So there is a question from Mr. Chopra. So Mr. Rakesh Chopra has asked that in the current turbulent situation, we come across people, those are highly workaholics, hypertensive, full of anxiety. What would you like to recommend for them so that are able to overcome this stressful habit in the challenging time?
So the first thing is people who are hypertensive, who are workaholics, they are people who worry too much. They always worry. Okay, in fact, they find new things to worry about. And these are also the people, even if the healthcare system is doing the best, even if the government is doing everything, they will find that one thing which they will say, but this should have been done that way. So my advice to all these people is, please, in fact, do whatever you can do to make the situation better. Okay, but at the same time, realize when you can't do anything more, and that is the time that you have to work on yourself. If you think that you're overthinking and you're feeling extremely restless, use your energies to exercise, to declutter your house, to help your friends in whatever way. So if you're an expert, if you're a financial expert, if you're a computer expert, if you're a tax expert, start giving lectures every day and help other people out. But at the same time, make sure that you are finding enough time to meditate, to listen to music, to start dancing, to finding a new skill, you know, and also maybe connecting with your family. So I have seen that these people are actually giving a lot of discourses in the whole day, okay, and are feeling better because they are helping other people out. So use your time productively, but at the same time, if you feel that you're still worrying, maybe these are the people who need to reach out to mental health experts and have one-on-one sessions with them, because they may need some medication at this time to help them to cope with their anxiety.
Yeah, so no, that's a very valid point, that finally one has to seek the professional help if not able to cope with by himself. This is what I understand you mean to say. At
Yes.
times it may be desired and nobody should feel shame about it, and there is no stigma or stricture attached to this strategy or methodology. So now we have a few comments as well as a few more questions. So Mr. Melvin Cornelio, as a very senior member, he has asked, we are lost our way by running like headless chicken and blaming others. No time for anything, etc. Yes, we got this time. How can we rediscover ourselves? How to get our potential out of us?
Absolutely. So, answer that I like to give for this is divide your day into 5. Okay. So, one is doing whatever work that you need to do. You should only spend 1/5 of your day doing that. The second 1/5 is taking care of your body, taking care of your sleep, your appetite, etc. Watch what you eat and also how many hours you're sleeping. The third part of the day is when you need to connect with your family and friends. Okay. The fourth part of your day is to spend some time discovering yourself and trying one new thing a day. So if you wanted to learn a language, this is the time you can do that. If you wanted to sing, probably get into the bathroom and start singing today. So whatever you wanted to do, this is the time to get into your chess championships, or to maybe find something, because we never had the time. And yes, we were all running around and we all kept complaining about that one thing, that we never have time. And 1/5 of the day, find different ways of helping other people. You never know, once you are continuing to do that, automatically by elimination, you will know what you're good at. You will discover some skills by the end of it. And there is something that we've been reading, I think all of us have read this, that if you come out of this period without discovering a skill, you've really wasted a lot of time. So I think let's try different things and see what works.
So I want to give a positive part of the whole story as a professional cardiologist. We are amazed and we have no answer in the cardiology fraternity that in those last 2 months, the number of acute myocardial infarctions, admission and coming to the emergency has gone down by 40%. This is data from USA as well as from the Europe. There is some concern that there might be some people not coming to the hospital and still they might have suffered.
Right.
Still, by all means, there is certainly a decline in the new onset acute myocardial infarctions or heart attacks. Is it a positive sign, Dr. Anjali, that people are staying at home and less stressed and less getting heart attacks?
Absolutely. In fact, what I would like to say is, I think actually in the last 1 month or 6 to 8 weeks, people have actually had the best health because they're eating at home, they're sleeping well. People are very careful about not, not increasing their alcohol too much, not taking too much stress, because immunity is really related to the stress. So I think people have had the best health thanks to World War C or coronavirus.
So at least we see a decline in heart attacks.
Yes,
And,
yes.
to tell you, Dr. Anjali, there is actually a project and a big international study has been taken over in Europe and America just to look into this aspect, that why and how is it happening and how far it is correct that we are actually getting a decline in cardiac heart attacks.
In fact, even road accidents have gone down.
Yes, yes.
A lot of
I know.
changes have happened in the last few.
Do you think that this is a season for infective diseases in India, otherwise also
Right.
non-COVID, like in a
Yes.
traditional way? And
Right.
I think this is my suspicion that this year, even that will go down because people are having so much distancing and so much more concerned about sanitization and hygiene. So even eventually the other infections will also go down.
So I'm
this
going
is also
to
blessing in disguise.
absolutely, but I'm going to share a joke with you. So yesterday on one doctor's group, there was one person who had fever, and he was discovered to have malaria. Okay, and people said, "Oh my God, thank God he has malaria." So of course, we laughed about it. That we're laughing because a person has malaria,
Yeah.
but thank God it was not COVID; it is
Not
malaria.
COVID, yeah.
Yes, yes, yes. But
Okay,
I think
so
all.
I have a question from Mr. Dinesh Kothari, who is an educationist here in Dubai, a very learned and renowned person. He says, I run schools with 15,000 students and 1,200 staff. There are parents losing jobs, so can't pay fees. Then we have employees at lower end supporting a family of 7 to 8 back home.
Right.
So how to balance this anxiety? For a month or two, we can plowing back earlier profits, but not in long run.
Absolutely.
Yeah.
Absolutely. And this is the situation world over. And what I am telling people to do is that you must start talking to all stakeholders, and nobody has these solutions. So one is,
Yeah.
you must have a very frank chat with your employees, with your employers, with all the stakeholders, and see what is the best way to tide through the crisis. If we can see, this is not the time to swim, this is the time that we need to tide through the crisis. So if you start, but the first step is towards realizing that yes, we have a crisis on hand, and how are we going to deal with it. In fact, because you run such a large organization, I would say that get everybody involved and tell them that yes, this is the problem, what do you suggest. When you do that, people know that you are concerned about them, people know that you care for them. And many of the times, like the example I gave earlier, the lady felt so bad. She's saying, I've never not given salary. How can I do this now? So I said, see, you know that, and your employees know that you have never not given salary. So talk to them and find out. Ask them, tell them that I genuinely don't have money. How do we deal with this situation? And you will be surprised at the answers that come. I've had people who have actually turned around and told their employers that, listen, you give me what you want, don't worry, I have enough. There was one employer who went actually to put salary in his employee's account, and that guy turned around and told him, listen, right now I have money, when I want money, I will tell you. So there are lots and lots of positive stories which are coming out in this. But yes, we need to open up. If we are not going to open up, if we are going to keep sitting, at a different level compared to our employees, then the solutions will not come. And yes, I'm sure you can, if you can discuss this problem here, I'm sure there are a lot of other people here in the forum also who will help you to solve the problem. But we need to stay calm. We need to understand that there is a problem, and we need to see there are some people who have promised their employees half their salary and said that as the months go up, we will give you your money, but we will stagger the payment. So I think we need to come up with new solutions, and also we need to cut down expenditure. So if there was some expenditure which was not required, we all need to see where we can cut that down.
Need versus desire, huh? Yeah.
Yes, absolutely.
Okay. So Setu Kumar wants to know that we now have fear of catching the disease from our visitors, friends, and even from the groceries delivered to us.
Right.
So when this lockdown is over, can we ever trust anybody else? How do we
Absolutely.
overcome this? Yeah.
So I think the human being is going to change. We've already initiated studies to see how the human being is going to change. As psychiatrists, we used to treat something which was called as obsessive compulsive disorder, when people would wash their hands so much. The first thing which came up in psychiatry groups was, should we stop treating OCDs? So people are going to be more worried about cleanliness and keeping a distance. In fact, one of the questions that we are asking people is, how will you feel if there are 30 people in this space? Since we are so used to this physical distancing, and yes, it's going to take time. Even if the lockdown is lifted, I don't know how many people will feel safe to go back to work again with people around. So working out of home may actually become a culture for so many people, because a lot of people are also realizing that you can do so much more, sitting at home. So it's going to take time. How the world spans out, we will know. There will be some who will get overexcited and who will start partying and say, okay, now I can meet people. But then there are those who are going to be a little more careful and almost paranoid about restarting life again.
So Dr. Anjali, one thing is clear, the life is never going to be the same again. In many different ways, it will be different.
We'll have to define the new normal, and maybe the new normal is going to be better. Who knows?
Yeah. So in the same series, Mr. Vivek Agrawala, he says that I'm very comfortable working from home, and I'm in a service industry. And once the lockdown is over, I may find it difficult to dress formally and go back to office. The same thing what you were telling now. How to deal with that?
Yes.
So Mr. Vivek, you can continue working from home then. That will be your new normal.
Yes. I think a lot of organizations will probably start doing that,
Yeah.
So, but people will also have to be accountable. And, the other day, I called one of my employees at 11 a.m. in the morning, and I realized I had woken her up from sleep. So that is also something that is going to be a new challenge. How do you clock in hours? What do you do?
Yeah. So clock in will be through the computers. You wake up and you clock in at 8 a.m. in the computer. So it means you're working, huh?
Yes. But you won't be able to work out of home.
To some extent, yes. We are also going into telemedicine to some extent. I will say not for us doctors generally, but still it is going to be a change for us as well forever.
Right.
And Mr. Atul Agrawal says that about the social media, you already touched upon this point, but I'll repeat his question, that we are glued to social media, especially children, WhatsApp, Netflix. Isn't too much of this media leading to a psychological disorder?
So social media, I would say, thanks to technology today and thanks to social media, we're even being able to do this. Can you imagine a world where we would have no technology? So in fact, the other day I was actually thinking that what if instead of the lockdown, we were told no technology days? I think by now we would have all suffered so much more, because social media is a very integral part of our life today. But of course, there are those who are getting addicted to either watching television, addicted to watching news. And we have to be a little careful about this population. So those of you who have young kids in the house, I would suggest do some physical activity together. Of course, at meal times, make rules that nobody's phones, no television should be on, but also start playing games together. The minute 3 people start playing a game together and that becomes interesting, the 4th person will automatically get out of his social media and come and play with you. But we need to take that initiative. So a lot of people have initiated playing board games together in this period. And
we also did.
Yes, and also, tell your kids to be involved in the house chores. There are some people who do not have their part-timers coming, especially in India.
Yeah.
So all of them have got their kids involved, and it's so nice to see that kids are actually enjoying this, because so far there was no necessity. But now, because kids are doing all this, they don't have time for social media. So it's working
Yeah.
both ways. But yes, to answer your question, if someone gets addicted, this person definitely needs more specific help. So you might need to consult a psychologist or a psychiatrist for that. And especially teenagers get hooked on to social media when they are going through an underlying psychiatric disorder like depression. So please reach out and see how to solve the problem.
Yeah. And there is then one Mr. Hemant Jetwani. He says concerned about the future part. The
Right.
world is faced with a dual stigma of health worries and financial worries, with the networks have been decimated all around for the big and not so big. In the immediate, we are worried about the burning fire of COVID-19, but the economic impact is bound to hit harder in due course. So how does one may manage that?
Right. So that's absolutely a worry that everybody has, because the more people are staying indoors, a lot of people are going to lose their jobs and lose their businesses. And yes, we need to be prepared for that. But I think this is a war and in war, there is always the postmark of a war. With this COVID war, we'll have to think about that postmark which will come up, and we need to prepare ourselves. Yes, by cutting down our expenses, by preparing new opportunities for the future. The other day I was listening to an economist, and he was talking about how this is really going to create a lot of opportunities for the future, because a lot of needs may come up and we may be able to fulfill those needs. So let's look at the positive side of it. And yes, let's be realistic. We can't just say that, oh, it's all going to be positive, but let's look at new ways of earning money, of sustaining ourselves. And each one has to discover, as each one has to take care of himself, each one also has to try and discover new skills that may help them to do better.
Yeah. So obviously it is uncertain at the moment, but this is how we have to go forward and think about the future.
And worrying is not going to help. In fact, keeping
Yeah.
a calm mind is going to help. So take time, even if you've not meditated before, this is the time. There's so many apps on the
Yeah.
phone. Just use it and try doing it. Look inwards, because the solution is only going to come from there. And yes, we should not be hesitant to downsize, because I
Yes.
guess that's the
Yes.
way forward.
And if you can't help yourself, contact Dr. Anjali.
No, you
That
can
will be the best
contact
way.
you can contact
Yeah.
any doctors who are
Yeah.
available to you, but don't hesitate in taking
Yeah.
help.
Yes, that is correct. And there's one with a very humorous question. So Mr. Murtaza asked, "We are like lions outside. I wonder if he really is. But now we are caged and feel helpless. How do we feel powerful in a cage?"
Right. No, so helplessness is a feeling again which is quite generalized. Like uncertainty, people are really feeling helpless because they are feeling that, oh my God, I could have done so much. The first thing and the only thing is we need to accept. The minute we accept that, yes, this is the situation, a lot of things will change. We need to use our restlessness by converting it into exercise, by converting it into writing about all your worries, talking about all your worries. The minute we cross that stage, and the minute we understand that, yes, this is what we can do. When I started, I said I was feeling extremely helpless because I felt my co-doctors are working in the front line and I can't do anything. But the minute I set up this system, which I could use, my helplessness went away. So the helplessness goes when we are doing our best to overcome the situation. So
Yeah.
try and move inwards and find out. And if you can't do that, use the help of a friend, a counselor, a psychologist to do the same.
Yes, that is correct. And then Mr. Jai Kishan Lakhwani, he says before to remove stress, we used to walk, but now we
Yes.
cannot. And so give some tips to remove stress because now the stress is much more.
Right, right. So you can do spot jogging, you can do skipping, you can do push-ups. You must exercise in your house, you know. And of course, depending on different governments, people have, you know, kind of made certain hours where you can go and exercise, you know. So we have stairs in our house. So a lot of the times we are running up and down the steps just to feel, you know, to exercise and to feel good. You can also try dancing. You know, this is something that I've been telling people. People say, oh, I don't know how to dance. No, you put on the music, put on a television, listen to music and start dancing, and dance as if nobody is watching, and don't worry about whether you know how to dance or not. But it is extremely important to exercise, because exercise makes you expend your energy and makes you feel good.
Well, that's a very good advice. You know, you don't need space. You don't need to go out, and you can still do the exercise just by dancing. I will start the next question. First, I will quote your word, your sentence, and then I will start the question. So you said that the only certain thing at the moment is uncertainty.
Right.
And this question is related to that only. So Mr. Saifuddin Diwan wants to know that as a medical professional, what is your assumption that how much time will it take to find a cure? And shall we have to wait 18 months, 6 months, 12 months, or what will happen? Vaccine will come or not? So,
right. So, of course, there are lots and lots of, I think the whole world is looking for this cure. Okay. And there's a lot of debate going around the world. But the fact is that we know that this virus, see, the reason why the lockdown has happened is not because the virus is very bad in terms of killing people, every person that it meets. In fact, 70% of the people will just go through it. But the problem is that because of huge number of populations, at one point of time, lots of people can fall sick. And when people fall sick, they will need the healthcare resources. And at such a time, the healthcare resources, the demand on the healthcare resources may not be able to be fulfilled. So the reason people have been asked to stay indoors is so that the healthcare resources can be given to the people who need it. Now, I think a lot of companies are trying to find a cure. But of course, even if a vaccine comes into the market, by the time the trials take place, and which is again happening at the fastest speed ever, you know, there are plasmas which are being given. So I think in a few months, maybe, you know, 2 or 3 months, I'm sure there will be some light at the end of the tunnel, you know. But of course, these are just predictions that are being made, you know. I mean, 3 months ago, nobody, if someone had to tell us that, you know, all of us are going to be sitting at home like this, no one would have believed them, right? So, but we have to hope for the best, and we have to do whatever we can to help the situation. And another, you know, suggestion over here is that we also need to take care of our healthcare workers. You know, in a lot of places, you know, the healthcare workers are also nervous. I start my day by talking to at least a few doctors who are working on the field, you know, because they are also nervous since a lot of healthcare workers have contracted the problem. So a suggestion to all of you, you know, there is a very old saying in India कि बचाया तो भगवान ने, खराब किया तो डॉक्टर ने. Okay, case खराब किया तो डॉक्टर ने खराब किया. I think we need to change that, and we need to understand that our healthcare workers are doing the best they can, and they are also getting infected in the process. So please,
that's a real concern for healthcare professionals. Yes. There is a question from Sama Srinivas. How to deal people who are not working as per your directions or interest, which gives us stress due to expectations?
Right. So the first thing is I think what we need to do is, you know, sometimes what happens is we just presume that people should understand what I'm thinking. Okay. This is the time that we need to communicate our expectations. You know, so for example, when I was sharing with you all that when I called my employee at 11 a.m. and she was still sleeping, you know, so I got a little upset because I said, you know, it's a working day, you should be working. Then I said that no, I have not communicated my expectations. So even my employees do not know what is expected out of them. So what I did was I got onto a Zoom call with all of them. I understood what they were going through. Somebody is staying alone, someone's parents are away, somebody is worrying about parents, someone's worrying about their kids who are staying away. Okay, so first understand what they are going through, and then tell them what your expectations are. Tell them that, this is what I expect from you. And also, if you're not able, and ask them why they're not being able to deliver according to their expectation. I also know that employees are really scared of losing their jobs, you know. So if you have
Yeah.
to give them a step by step, saying, okay, this is what I expect out of you, and then maybe have a joint meeting with other people. So this is what I did. I had a joint meeting with all the other people. So when one employee felt that the others were doing better, automatically it's a kind of a competition that people want to do. So motivate your staff, and tell them, kind of reward them in certain ways. And I guess that should help the situation, and if it
Okay, yeah.
doesn't work, then
Yes.
then they know what they are in for.
There is a comment as well as a question from Dr. Mamta. So she has first thanked and for this insightful and comforting talk. And she has a concern that once this crisis is over in a few months, the economy will take precedence over everything else, including the health.
True.
And that could be another ground for worries, that people will be all working only for economy.
Absolutely. Absolutely. So this is everybody's fear. In fact, there's also a fear that, there could be social unrest, and there could be a lot of things that we have never seen before.
Yeah.
And honestly, I don't think anybody has the answers for that. But we have to do our best by, doing whatever we can as individuals, as companies, and try to help whoever we can, and be in it all together.
Yes. There are two more participants who put in their, I wouldn't say question, but rather comments. So one is worried that she was to move her house. She is all packed up and she is unable to do that. And she is quite distressed, Miss Mary Antoinette. So, so that is her dilemma. And boxes, you say many packed boxes, and how to live, either to unpack or to move or what to do.
Right.
Yeah.
Of course, now again, that depends on the area that you're living in and what essential services are open, So interestingly, I spoke to somebody else the other day, and they said in our area, we are able to move, and is the right time to move because the rent over there is lower. So I guess that's a very local based question, which I think somebody else can help you in the panel,
Yes, and then there is also a comment from Vinita Kesani. It's a long comment, but I will take 2 points out of it. One is that she says that we need to keep fear out of our busy work to remove the stress. This is not a question. She is just given her comments. And she's also said one thing, that we should also be ready to have an alternative source of income, because we do not know which one will work better for us, income A or income B. So I hope you will.
So fear is one thing. Fear is it's like, suppose I tell you keep fear out. It's like if I tell you don't think of the blue elephant. The more you focus on fear, the more it happens. But I think fear goes away when we accept situations. And yes, this is the time to not try a second income, but to try 5 incomes and see what may work, and leave the shame out. The minute we leave shame out, a lot of things fall in place. And the minute we share our emotions and share our stress, so that is something, that's the way to move forward.
Good. I have 1 or 2 questions from my side. That first, have you really seen an increase in your clientele because of high stress? How do you see and in last 4 weeks your clientele coming up, and in what way?
No, so I'll tell you. So interestingly, lots of things have happened. There are some people who used to get anxious about going to work. So they are very relaxed now. There are some people who had to be forced to go out and work. They are also relaxed. The number of suicides have decreased at some places and have increased in some places. Okay, so some of them have decreased because they have people around them. And because of that, they don't feel lonely any longer. But then in some places, because of the stigma associated with COVID, we had, unfortunately, India had a few people who thought that they were going to be stigmatized, and they were the ones who committed suicide. Okay. So what I feel is that this lockdown is an interesting period where some people's stress levels have lowered, but there are those who are showing higher levels of stress. The other day, I got a call from a wife because the husband was throwing the daughter in the middle of the night out, So what had happened was all this stress led to, and he's a person who was suffering from bipolar disorder. He was quite controlled, and now suddenly the symptoms had flared up. So we are also seeing that some hospital admissions have gone up, So it's a mixture, it's a mixed bag that we are seeing.
Yeah, nice. Before we finish up, I would just pick up this point that we can divide this phase into two parts. The one is a contemporary part with which people are locked up, not able to work and under stress, and sometimes they have less stress. Either way,
Right.
But then there is a period, late period, once everything is over, and something much better than me is a post-traumatic stress disorder, which is not meant for post-infection disease up to now.
Right.
So will you look at it as a PTSD? You are expecting some kind of PTSD after this thing is over?
We are definitely thinking that there will be some amount of PTSD that will come up. Earlier, if someone coughed and sneezed or had a fever, people would say, "Oh, it's just the flu," right?
Yes.
Today, if somebody coughs, even on a call, immediately a person gets worried. So there is going to be some amount of stress that will happen. Okay, I think for the next year or so, before we really find a cure to this, and people are going to change, people are going to worry. If your spouse comes home, if your child comes home with a fever, people are going to be definitely getting stressed, getting over worried, getting anxious, and many of the times, and we'll have to see how that spans out.
Yeah. Wonderful. So on behalf of all the viewers, Dr. Anjali, I believe it was a very, very wonderful presentation of the facts of the current situation from your side. It can't be better than this in the most simple words, in the most friendly manner, without any slides, because when I give a lot of talks, actually I keep giving. So I always use my slide set and I go slide by slide. It is a freehand talk, which was an absolute wonder. And in this series, first I will start thanking Mr. Sinha for conceiving this idea of inviting you and putting this kind of a special talk, which is so relevant and so important. And Mr. Sutarwala, I didn't know, I have met you many times, but I didn't know that you are so good in arranging the technology, which we are still learning. And you have done a wonderful, great job in putting up all together. And my last comment is obviously for Dr. Anjali. Thank you so much for being with us. And the technology has given us a lot that now we are from Bombay, we can talk to you as good as we are sitting here. So everything gives us a learning. This COVID has given us a learning. If any last comment from Mr. Dilip, I'll be most happy, and else we say goodbye to all our viewers and friends.
Thank you.
Yeah, thank you, Dr. Mithil. I think you have done a very good job, represented all the questions. And Dr. Anjali, once again, thank you on behalf of the Governing Council, the Chairman and the Management Committee, and all the focus groups that we have. Thank you, and we look forward to more interactions, maybe in physical, in terms of some convention or something in future. And let's hope this thing passes very soon. Thank you, and stay safe, and have a good day. Thank you very much.
Thank you. Thank you. Good day to everybody. Thank you.